All right, today we're tackling something that sounds pretty scary, a collapsed lung. But we're going to zero in on a very specific type called a simple pneumothorax. And trust me, that word contained is going to be the hero of our story today. Let's get into it.
So let's just start with the big question right off the bat. What actually happens when a lung collapses? I mean, the phrase itself is super dramatic, and yeah, it can be. But the details are what really matter here.
And that leads us right to our main event, the simple pneumothorax. You know, that word simple is probably the most important part of the name, and we are about to find out exactly why.
Okay, so this is the core definition right here. You've got air getting into the space around the lung, it's called the pleural space, and it pushes on the lung, causing it to partially collapse. But look, the most critical part is what doesn't happen. There's no mediastinal shift, which means your heart and your windpipe aren't getting dangerously shoved out of the way, and there's no hemodynamic compromise, which is just a fancy way of saying your blood pressure and heart rate are holding steady. That word without on the slide, yeah, that's everything.
So the next logical question has to be, if there's air in a place it's not supposed to be, how in the world did it get there? Let's take a look at the usual suspects.
Basically, the causes fall into two big buckets. First, you've got spontaneous. This can be primary, where a tiny little air blister on the lung, they call it a bleb, just pops for no good reason. It happens a lot in tall, thin people, believe it or not. Or it could be secondary, meaning it's caused by another lung issue like COPD. Then you have the second bucket, traumatic, and that's pretty much what it sounds like, a chest injury. Sometimes, though, it can be an accidental side effect of a medical procedure, which has the technical name iatrogenic.
Okay, so we know what it is and where it comes from, but what does it actually feel like for the person going through it? Let's talk about the signs. What should you be looking for?
Well, the classic story usually starts with a sudden, really sharp pain on one side of the chest that makes you not want to take a deep breath. And that's followed pretty quickly by shortness of breath. Now, if a doctor listens with a stethoscope, the breath sounds on that side will be super quiet or maybe even gone completely. So, naturally, the person starts breathing faster to try and make up for it. Of course, how bad these symptoms get really depends on just how big the collapse is.
And here we are. This is, without a doubt, the most important part of this whole explainer. Getting this next point is absolutely crucial because not all collapsed lungs are created equal. This is where simple really earns its name.
Let me say this as clearly as I possibly can. A simple pneumothorax is not a tension pneumothorax. Think of it like this. One is a leaky tire, and the other is a tire that's about to explode. Right? Both are problems, for sure. But one is a manageable issue, and the other is a full-blown, life-threatening emergency.
Okay, let's break this chart down, because this is huge. Over on the left, with a simple pneumothorax, things are pretty stable. But on the right, with a tension pneumothorax, it's a disaster. Air gets trapped, and it acts like a one-way valve. Air gets in, but it can't get out. So this insane pressure builds up inside the chest. It gets so bad it actually pushes your windpipe over to the side. It squeezes the big veins that bring blood back to your heart, causing your blood pressure to tank and your neck veins to bulge out. A simple pneumothorax is defined by the complete absence of all those terrifying high-pressure signs.
So, to boil it all down, the simple in simple pneumothorax basically means it's missing all of these scary red flags. The pressure is contained, and the body's most important systems aren't about to shut down.
And now for the good news. Because it's a contained problem, there is a very clear and well-established path to recovery. So how do we fix it?
Well, the treatment isn't one size fits all. It's really tailored to how bad the collapse is. If it's a really small, stable case, the doctor might just say, let's watch and wait, and let the body heal itself. Giving the patient some extra oxygen can actually help the body absorb that trapped air about 4 times faster, which is pretty cool. For a bigger collapse, a doctor might do an aspiration, where they use a needle to just pull the air out. And finally, if the leak just won't stop, or the collapse is really big, a chest tube is put in to drain the air continuously and let the lung inflate all the way back up.
And this quote right here, it just nails it. It's a contained collapse. Look, it is absolutely a serious medical issue that needs attention, but because that pressure isn't building and spiraling out of control, it doesn't have that immediate ticking time bomb feeling of its dangerous cousin, the tension pneumothorax.
So if you walk away with just one thing from all of this, let it be this. The line between simple and life-threatening is all about pressure. A simple pneumothorax is a leak without that dangerous runaway pressure that shoves all your internal organs out of place. And understanding that difference, well, that's everything.
You know, this huge difference between a simple and a tension pneumothorax really shows how two related conditions can have completely different endings. It gets you thinking, right? What other critical distinctions in medicine are just as important to understand? It's something to chew on. Thanks so much for joining us for this explainer.